All right, team, we are plugging away here. We are now on Unit 3, Part 1. There's 2 parts to this, and let's get right into it. Okay. So, medications. What is a medication? So, this whole time you have been hearing how do you administer it, what are you supposed to do, what you're not supposed to do. But actually, what is a medication? Medications are substances created to improve quality of life. It does this by reducing or eliminating negative symptoms. It's used to treat illnesses, diseases, pain, and behavior. Once med is in your body, it's in there. We're just going to have to let it process. And so that's why you don't want to make any mistakes because you can't take back, right? So substances into the body and they change one or more ways the medication works. Now, we did talk about this brand and generic name. We've talked about it several times, and I keep using the description of Tylenol. Tylenol is the brand, and acetaminophen is the generic. Now, usually acetaminophen is, or the generic, I should say, is less expensive than the brand and equivalent. So I've given you the example of going to CVS and you'll always find the brand at a higher price, and right next to it is the generic version. Now, there is one exception to this that I found. I haven't done research to see if it's documented, but I do know that seizure medications, for some reason, the brand and generic do not work the same. And most physicians, nurses, people who have family members that have had seizure history will tell you that. Now, I always give this as an example to segue into if you don't want the pharmacist to change and give you the cheaper, less expensive version, the doctor can simply write on the prescription, no substitutes or brand name only. Okay, so I tell you that so you could advocate for your client, especially when it comes to seizure medications. So on page 32 here, again, I have put it here, and if it's difficult for you to see, some people have told me they could see just fine. You could pause and then restart when you do the exercise. But this exercise says, review the pharmacy labels, fill in the generic medication supplied. And basically, this exercise is to make sure you're able to read the pharmacy label, and it's talking about looking at the interchange. So remember the IC that I showed you, interchange, meaning they could swap for one another. And so if the doctor writes one name, the pharmacy will send you both. So you know that, hey, you're not going crazy. Is this the med I'm looking for? It is. It's just a different name. So I want you to look at the 3 here, Zestro, Prilosec, and Motrin. Then look at the pharmacy labels, which are these 3 down here, and write the other name, the generic medication name for it, okay? Let me see, so I have my little Jeopardy, and then when I start to go over the answers as per usual, just pause it if you're not done to give your chance of self to finish, and then you could start it when you're ready. All right, so if you look here, Zestro, let me see, should I make this a different color? The other name you see is lisinopril, interchange IC for Zestro. So what you would put here is lisinopril. I'm just going to put like LIS because it's too hard to type the whole thing. Lisinopril, okay? Let's just do that. Now, the next one, Prilosec, when you look over here, down here, it's omeprazole interchange for Prilosec. So the answer there is omeprazole. So this exercise is just designed that you know how to find both your names on the pharmacy label, which you know because we did a very in-depth pharmacy label review. And then Motrin, it's ibuprofen, interchange for Motrin. So the generic name for Motrin is ibuprofen. Now, I always tell people after this, you all might as well go to nursing school. You learn so much, right? Okay. So, lisinopril, omeprazole, ibuprofen are the answers. And while I have you here, although it's not that, I just want to reinforce, as you remember, right after the medication name on the pharmacy label is the strength, okay? So I will just, repetition is key. I will always reinforce that even though we're not doing med math at the moment. I'll put my little S just so you can remember and have that come back to your mind. Okay. Medication schedules. So if you have some knowledge about medications prior to this class and how they're classified, I want you to forget that because it's a little bit different, okay? So here, everything that comes into the home, right, needs a prescription label on it. This is even if it's over the counter or I'm a vitamin shop girl. I absolutely love it. So I go there and buy all my vitamins and things like that. Everything that comes into the house has a label on it, and it is a controlled substance, okay? Controlled meaning if you come to my home, you'll find vitamins and capsules and herbs and whatever sitting lying all over the place. They're not locked up. They're not really controlled. I'm not tracking them. But this is a group home scenario. Everything is controlled because we have to know and we have to give it to our clients, okay? So everything that comes into the home is controlled. Now, some things have two categories, will be controlled, countable, and I keep threatening you with this more slides on countable meds, and you're like, when is it coming? It is. So you'll get a whole section on that. So some things that have potential to really be abused, not only are controlled, but are controlled and countable, meaning every single time you have to actually count them, how many tabs you have left. Okay, so you have two categories of meds. You have controlled, which is every single med is controlled, meaning it has a prescription on it. And then you have control countable. Not only does it have a prescription, it now has to be double locked, okay? And it has to be counted in the count book. So that's why when we were doing your med pass, you have that count book section. All right. Now, prescription medication. This goes without saying, you can't photocopy it. You can read that slide on your own. And these are the categories that we were talking about: controlled, which is all of them, and countable, controlled. I think I said it controlled, countable, but you get the idea. And they'll test you on that. They really don't use like whether it's Schedule 6 or Schedule 3 or things like that. They usually just use the term controlled or controlled countable. That's what I've seen. Now, over-the-counter meds have to be labeled in your program, okay? Okay, so controlled medications, you need a doctor's order for all medications anyway. They have to be pharmacy labeled. Now, if you buy an over-the-counter medication, say for example, I don't know, pharmacy can't deliver it, it's something you could find at CVS. As the MAP consultant for the organization, we have to read the label, and then we have to read the manufacturer's label to say that it is indeed that medication, and then we have to label it. So either way, everything gets labeled in your home. I already talked to you that they have to be in the tamper-resistant blister packs. Some things are in tamper-resistant bottles, or like the syringes, and I've only seen that we have a couple of hospice patients, and so the liquid morphine is, you could tell if somebody opens it, the seal is broken. Just think of a gallon of milk. Once you open it and crack that seal, what does your mom always tell you? Don't buy, they always tell you don't buy things with the seal broken. So you could think of it like that. It's secured, controlled, so this isn't countable controlled, so it's just secured, locked, it's not double locked. And then you track it. We're going to go over all the tracking logs, so right now you don't have to worry about that too much. Now, countable controlled, meaning it's double locked. Again, you need a doctor's order, which you always need. You need pharmacy label, which you always need. And then the only packaging options is tamper resistant, which all of them end up being anyway. Blister pack, and then you need the identifier. So this is, you've seen the picture of the blister pack. These are the ones for the liquid, and once you take that seal off, you know that it's been broken. So for some reason, if you went in and the seal was broken, you would know someone probably tried to use it and maybe put some other substance in it, okay? So that's what we mean. Remember in the past videos when I explained what do we mean by tamper resistant. So countable controlled are double locked. So just so you could picture, if you haven't seen where people keep the meds in your program, for example, a lot of people have a closet, you know, their home, so they take a linen closet or something like that and put a lock on it, and that's where your medications are. But once you open that linen closet, you'll find a little, I should have my little box here. This isn't a box, but you'll find a little box within the closet that needs a lock. And so that's what we say when we say double locked, okay? So your countable controls are double locked. Now we track them from the minute pharmacy knocks on your door, knock, knock, who is it? I have a medication for you. You sign, it starts the tracking process, and there's different sections where we'll go over that. Now, on a countable control, you have the keys to that second lock. It's like a little, think of it like a little safe box, and you do a count every time keys exchange hands. So don't worry, there's going to be a count video, and you will be able to see that, and we're going to pay special attention to the count book. All right? So over-the-counter meds, just as I discussed, you need a doctor's order, pharmacy labels, locked, tracked. There's nothing different about an over-the-counter med. The only thing different is that you have to call your nurse, or whoever your MAP consultant is for your program, and they have to read the manufacturer's label and put a label on it for you. Dietary supplements are the same. If you think most of them that I see is Ensure or Juven or something like that, but it's a medication. If someone is, you might think, okay, why is Ensure a medication? If someone is anorexic and the doctor orders 3 Ensures per day, that's extremely important. So that's a doctor's order, and we label it and track it as such, okay?